Have you ever felt a sudden wave of anxiety over something that seemed minor? Well, you are not alone. About 1 in 13 people globally are struggling with anxiety disorders. Hello, friends, and welcome to my channel. I am Dr. Dawny Mathew, a consultant psychiatrist. Today, we are taking a look at a problem that silently affects millions: anxiety. Stick around because this topic might be more relevant to you than you think. In the heart of Mumbai, a city that never sleeps, lived Sara, a 28-year-old marketing executive. Known for her quick wit and infectious energy, she was the epitome of a successful young professional. But one evening, a traumatic experience on the rainy roads of Mumbai set off a chain of events that would change her life. Sara's story began on a stormy monsoon night as she drove back from a late meeting. The streets were blurred with heavy rain and the visibility was low. Suddenly, out of nowhere, a truck raced through a red light, heading straight for her. Instinctively, Sara turned the steering wheel, narrowly escaping what could have been a fatal collision. She tried to slow down her car but hit a nearby traffic island. Her heart was pounding, her body shaking rigorously. She was taken to a nearby emergency room of a hospital where doctors informed her that she had only minor injuries and she did not need to be admitted to the hospital. She came back home the same night. While her physical injuries healed, the incident had left a deep psychological scar. In the following days, Sara's once vibrant world began to close in. She felt a constant sense of nervousness, her mind always on edge. At work, where she once led meetings with confidence, she now sat quietly, her hands trembling under the table. Her heart raced uncontrollably, and she often found herself breathing rapidly as if she couldn't get enough air. Sara tried to push through, believing she could regain control. She tried to calm her mind with meditation, sitting quietly and trying to clear her thoughts. But the more she tried, the more her mind raced. Sleep was hard to come by. She would lie awake at night, tossing and turning, her mind replaying the near accident over and over. At work, her concentration dropped. Projects that she would have handled effortlessly before now felt too difficult. Her mind was constantly clouded, fixated on the memory of that rainy night. She also began to avoid driving, and the thought of being behind the wheel triggered a deep-seated fear and anxiety. Physical symptoms soon followed. Sara started experiencing an upset stomach and irritable bowels. She initially dismissed them as stress-related, but as her anxiety persisted, so did her stomach issues, adding another layer of discomfort to her daily life. The continuous worry and fear began to feel like a heavy chain around her neck. Sara found it increasingly difficult to control her anxious thoughts. They were like uninvited guests in her mind, leaving her mentally drained. Sara's social life also took a hit. She began declining invitations to gatherings, especially those that required travel. The thought of being in a situation similar to the accident triggered a sense of vulnerability and panic. Her world, once full of friends and laughter, began to shrink. Realizing that her anxiety was not fading on its own, Sara sought professional help. She reached out to a renowned psychiatrist. He listened to her story with empathy and diagnosed her with an anxiety disorder which was triggered as a result of the traumatic near accident. The psychiatrist prescribed a course of medication to relieve her symptoms and introduced her to cognitive behavioral therapy. Sara embarked on this new journey with a mix of skepticism and hope. The medication helped stabilize her mood and manage the physical symptoms of anxiety, making her feel calmer and more in control. CBT, on the other hand, offered her tools to reframe her anxious thoughts, helping her challenge and change her patterns of negative thinking. As weeks turned into months, Sarah began to notice a transformation. The medication helped to reduce most of her symptoms, allowing her to engage more fully in therapy. Through CBT, she learned to control and restructure her fears about driving and accidents, gradually reducing the power they had over her. Her sleep improved, and with it, her energy levels during the day. She began to regain her focus at work, rediscovering the confidence and clarity that had defined her career. Sarah started to reintegrate into her social life. She resumed driving, initially on short, familiar routes, and gradually extended her journeys as her confidence grew. The trembling and sweating that seemed an inevitable part of social interactions began to fade. The road to recovery was not easy, but Sarah made it through. With the help of a psychiatrist, medications, and therapy, she overcame the hurdles of her post-accident anxiety. Her journey serves as an excellent example of the importance of seeking professional help and the potential of targeted treatment to restore the balance and well-being in the face of mental health challenges. Anxiety disorders are complex and can stem from a variety of factors. Let's explore these in short. Traumatic events can significantly impact our mental health. Whether it's a childhood experience or a recent event, trauma can be a key trigger for anxiety disorders. This includes witnessing a traumatic event or enduring personal loss. But it is not just about what we experience. Our genes also play a role. Inherited traits can make us more susceptible to anxiety disorders. If someone in your family has an anxiety disorder, it might increase your risk of developing similar challenges. Medical issues can also be a hidden cause of anxiety. Conditions like heart disease, diabetes, or even thyroid problems can manifest symptoms of anxiety. And it's important to talk to your psychiatrist about medications that you are currently on and the use of psychoactive drugs. Withdrawal from certain drugs, including alcohol and some medications, can trigger anxiety symptoms. In some cases, anxiety can even be a side effect of medications. Several factors can increase your risk of developing an anxiety disorder. Stress due to another major medical illness, a buildup of smaller stressful life situations, and even your personality type can contribute. And of course, if you have other mental disorders like depression, that can also play a role. So, what does this mean for us? It means that if you are struggling with anxiety, you are not alone and it's not your fault. Understanding the causes can be the first step towards managing your anxiety. Remember, seeking help is a sign of strength. If you or someone you know is struggling with anxiety, do not hesitate to reach out for professional support. Thank you for watching. If you found this video helpful, please like, share, and subscribe. Also, comment below how your anxiety has affected your life. Stay tuned for more videos where we simplify mental health together.